let's move more into the sort of a clinical picture. So, I have a lot of autoimmune patients. I have obviously cancer. I have a variety of everything, right? Of everything that everyone has, including myself, my family, and beyond. And we talk about, as you just mentioned, removing chemicals and sort of eating the foods that support us. But I want to kind of ask about a word that's gotten a lot of attention, which is inflammation, which tends to be more of a descriptive of clinical medicine. And almost everyone who's listening, I'm sure, and doctors, of course, we all speak that same language. We can understand the word inflammation, and we believe it's not good. And I believe that inflammation is not good, but there is some inflammatory processes that we know are good, and they're protective. So I wanted to, kind of balance that out. I'm not saying all inflammation is good, but just, are there components of our immune system that clinically are relevant, that help us heal? And what are the foods and practical suggestions for helping that inflammation balance, that homeostasis that we're really trying to, achieve?
Fantastic question. And look, to have somebody with your background, Dr. Cohen, a rheumatologist that studies inflammatory diseases and treats inflammatory diseases, say that some forms of inflammation are actually beneficial, I think sends that message, because your world is really all about taming inflammation and getting back to the balance that we actually need to be healthy. Okay, so I'll give you my vantage on inflammation and why it's important. And because I think a lot of the things that we see clinically and what we experience as patients ourselves is we tend to experience the extreme, and the terms that we tend to associate are with extremes. And this is where I think that, I'd like to maybe take out my hammer and smash a couple of myths. So everyone hears that inflammation is bad, must crush inflammation, and not true. Okay. Inflammation is one process that our immune system actually controls. Our immune system is very complicated. I always say our immune system is kind of like an army of super soldiers, of special forces, and the different cells all are trained to use their own weapons to do their own thing. And inflammation is one of those acts or processes that part of our immune system plays a role in for health. So you're like, wait a minute, inflammation and health? Why is that? Well, look, inflammation is necessary because what inflammatory cells do is they're called into action. Special forces, those special forces go into action whenever you have something like injury. You cut yourself, have surgery, you injure yourself in some way, a dirty wound, okay? The body's reflex is to send a few of these special forces, inflammatory cells, to that area to check it out, and with the idea that there might be bacteria there. And what they do is they light on fire this process called inflammation to burn out and destroy harmful bugs. And by the way, that fire that it lights is also a signal for healing that tissue as well. Mother Nature is really clever. So the same fire that burns out the bad guys is designed to trigger all the healthy cells to actually finish healing, right? Now, I can tell you this because I also, in addition to cancer research, I also study wound healing. And wound healing, you cut yourself, within the first few minutes, seconds to minutes, you get an inflammatory response. You ever cut yourself and you see the first thing that happens, even if you're not bleeding, is you get this like pink swollen area around wherever you cut yourself. And it's a little painful, but it swells. And that's inflammatory cells coming in there, dumping all those signals, cytokines to bring in that fluid. It's killing any dirt and removing any dirt, bacteria. It's gobbling all the bad stuff away. And then naturally, over the course of, let's say, the first 2 days, 3 days, inflammation will go, all right, we got everything cleaned up. Time to, go back to the shop. And so all the inflammatory cells go away. Inflammation goes back down. Wound is cleaned up. The fire's triggered the healing process. And that's basically what happens inside and out of our body. That's why inflammation is a good thing. By the way, it's the fall and you're sitting on an airplane. Let's say you decide not to wear a mask in today's world, and somebody next to you's got a cough. You're breathing in some of their germs. All right. And I'm deliberately not using trigger words. Okay. But you're breathing in germs, and those germs are going to go into your lungs. You know what our lungs do? They mount inflammation.
Correct.
Right? Our body senses that, send the same special forces out, They see the same thing. They cause the same swelling. That's why when you get a cold or, you start to cough, you get a little congested, a little runny nose. That's all these little things, the inflammation is going on. So good until it's bad. All right. When it's bad, the inflammation doesn't stop. It doesn't go away after 48 to 72 hours. It just sticks around. Okay.
Right.
And instead of allowing healing to go on, because, it's like the cops that actually go back to the station, everything is calm in the neighborhood. The cops are out there and now they're busting out the boom boxes and having a riot themselves. Now you wind up having a problem. And I'll give people like when inflammation doesn't go away, it's that fire that continues to burn. And the best analogy I'll give you is that think about inflammation like like it's fire, right? So imagine you're camping and you're out there with your friends and you have dinner, and then you're going to make a campfire and you're going to, warm yourself around the campfire. You're going to, toast marshmallows or, drink hot chocolate, whatever you're going to do, dark chocolate. And I would use natural marshmallows and not to eat any of them, definitely dark chocolate. All right. But what do you do at the end of the evening, right? That's inflammation in your fireplace. It's all contained right in that area. You're warming yourself. It's serving a really important role. When you're going to go to bed, you put the fire out. All right. And then you go back into your tent and then in the morning you start it all over again if you need to. All right. That's normal inflammation. You start it and it goes away. Chronic inflammation is like that fire you don't put out. You going back into the tent anyway. And now wind comes and blows the embers out of your fire pit into the forest. And now the forest is catching on fire. And first it's a brush fire and then it starts burning the trees. And now you've created a massive forest fire.
Right.
That can't be put out easily. It's not going to go up by itself. And now it's even threatening you sleeping in the tent. That's the analogy of chronic inflammation. It's the fire that jumped out of the fire pit that didn't get put out naturally and wound up actually going and spreading all around and creating a threat to the body. And that's what we see in diseases like chronic inflammatory diseases. You see this in lupus. You see this in rheumatoid arthritis. And by the way, you see this in cancer as well. Cancer stokes that fire, or if you have that fire, it'll trigger cancer to grow even faster. So that's really the explanation of why we hear about inflammation being something that needs to be tamed. But we should all know it's intended to be healthy, just a short amount of it, and our body should usually tame itself. So what can we actually do besides taking steroids and taking non-inflammatory, non-steroidal anti-inflammatories, all the medical stuff that we write prescriptions for? I can tell you simply, many foods contain anti-inflammatory benefits, simplest one being vitamin C, ascorbic acid. And foods that contain vitamin C, they are really good at lowering inflammation. What are some of those foods? Strawberries, tomatoes, red bell peppers, broccoli, all great foods that are good for so many other reasons. They have anti-inflammatory benefits. And in fact, there was a study that I cite in my book in Japan. There's a Miyagi prefecture. There's a lot of women who have lupus and they have really bad lupus flares. And there was a study done to show that women who ate more vitamin C containing foods, strawberries, tomatoes, red bell peppers, broccoli, there's so many other ones as well. You can look them up. Okay. This is the amazing thing about, the internet. One of the good things about the internet, vitamin C, foods, inflammation, clinical study, boom, hit return, and you'll find resources that'll be put right to your fingertips, just like mine. All right. They show women who ate more vitamin C containing foods had lower levels of inflammatory markers in their blood. And they also had lesser and less severe flares of their lupus as well. Right. So we know what works. And these are decisions that we can actually make.